Offering our collective respects to Sadguru Sri Madhusudan Sai, dignitaries, delegates and participants, ladies and gentlemen, namaste and a very good morning. It is our privilege and honor to welcome you all to this Global Conference on Healthcare 2023, presented by Sri Madhusudan Sai Institute of Medical Sciences and Research, co-hosted by the All India Institute of Medical Sciences, New Delhi. Mr. Ramesh Babu Potluri, Chairman and Managing Director, SMS Pharmaceuticals. Sri Dharmadata ji, former Drug Control Director, Andhra Pradesh, and advisor, Sri Madhusudan Sai Institute of Medical Sciences and Research. All of us, we extend a hearty welcome to Dr. Minu Bajpai, Executive Director, National Board of Examinations, and former Dean Academics, AIIMS, New Delhi. From Sri Sathya Sai University for Human Excellence, we have Chancellor, Sri B.N. Narsimha, and our revered founder, Sadguru Sri Madhusudan Sai. Our revered founder, Sadguru Sri Madhusudan Sai, social and spiritual leader who is spearheading mammoth service projects in nutrition, education, and healthcare across 33 countries. We also welcome Dr. M. Srinivas, Director, All India Institute of Medical Sciences, New Delhi, who has joined us virtually this morning. We request the dignitaries to kindly come forward and light the lamp, signifying an auspicious beginning of the conference.
Asato ma sadgamaya tamaso ma jyotirgamaya mrityorma amritang gamaya. Om Shanti Shanti Shanti.
Girl students of the university pursuing Vedic studies program will chant verses from the Mahanarayana Upanishad as part of the invocation.
Shri Gurubhyo Namaha Harihi Om Sahana Vavatu Sahanau Bhunaktu Saha Viryankaravavahai Tejasvinavadhitamastu ma vidvishavahai. Om Shanti Shanti Shanti. Atha Purusho Havai Narayano Kamayata Prajasrajayeti Narayanat Prano Jayate Manas Sarvendriyani Cha Kham Vayurjyotirapah Prithvi Vishwasya Dharini Narayanat Brahma Jayate Narayanat Rudro Jayate Narayanat Indro Jayate Narayanat Prajapatayah Prajayante Narayanat Dvadashaditya Rudravasavah Sarvani Cha Chandagumsi Narayana Deva Samutpadyante Narayane Pravartante Narayane Praliyante. Om पृथिव्यौ च नारायणः कालश्च नारायणः दिशश्च नारायणः ऊर्ध्वश्च नारायणः अधश्च नारायणः अन्तर्बहिश्च नारायणः नारायण एवेदगुं सर्वं यद्भूतं यच्च भव्यम् निष्कलो निरञ्जनो निर्विकल्पो निराख्यातः शुद्धो देव एको नारायणः न द्वितीयोऽस्ति कश्चित् य एवं वेद स विष्णुरेव भवति स विष्णुरेव भवति ॐ वासुदेवाय विद्महे सुधाहस्ताय धीमहि तन्नो धन्वन्तरिः प्रचोदयात् ॐ शान्तिः 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 हरिः ॐ तत्सत् श्री साईश्वरार्पणमस्तु
It is said, no man is an island. It means as human beings, we cannot thrive in silos, particularly in this age and in these times when the health and well-being of one person is directly dependent on the well-being of everyone else. The pandemic reiterated to us this very message, and in no uncertain terms. The mission statement for United Nations Sustainable Development Goal 3 is to ensure healthy lives and promote well-being for all at all ages. For healthcare to manifest from being a universal right to becoming a reality, it is imperative for all stakeholders to come together and function as a single unit, striving for a common cause that is greater than individual ideas and aspirations. And that goal is to facilitate healthcare delivery at the doorstep of the last man standing in every remote rural area. Transcending geographies and boundaries, service initiatives not just in healthcare but also in education and nutrition are being undertaken under the leadership of Sadguru through his global humanitarian mission. We will now have a short video highlighting some of these aspects. May we have the video, please?
One world, one family, an ancient ethos that ensures happy and harmonious living is the mission statement of the young humanitarian and visionary Sri Madhusudan Sai, who walks the footsteps of his master, Sri Sathya Sai Baba, the 21st century spiritual master and philanthropist. Christened as the Sri Madhusudan Sai Global Humanitarian Mission, several institutions of public service have been established in just the last 11 years, touching and transforming the lives of millions of individuals across 33 countries, with its epicenter at Sathya Sai Grama in the village of Muddenahalli near Bengaluru Airport in the South Indian state of Karnataka. Drawing its inspiration from Sri Sathya Sai Baba's message of love all, serve all, this mission aligns with the promise of the 2030 UN Agenda for Sustainable Development, leaving no one behind. Nutrition, education and healthcare are fundamental rights of every human being and every child, and it is the collective responsibility of the society to ensure that these basic needs are made accessible and available for all without any discrimination and absolutely free of cost, believes Sri Madhusudan Sai. Thus, it all began. Let no child go to school hungry ever is the motto of the Annapurna Morning Nutrition Program, which started in the year 2012. Today, healthy morning nutrition in the form of cooked breakfast or through the SciSure multi-nutrient supplement is served to over 3 million school-going children every day in 23 states and 5 union territories in India and 5 countries overseas. 516 million nutritious morning meals have been served as on date by this India's largest morning nutrition program. Feed the World is yet another global nutrition movement that has served about 5 billion meals to needy homeless individuals in over 15 countries. In the field of education, this mission has established about 28 educational campuses in India and 3 campuses overseas to bestow values-based education completely free of cost to about 5,000 children from the rural strata of society from grade 6 right up till doctorate studies. The Sri Sathya Sai University for Human Excellence, which is the higher education wing, has established India's first free private rural medical college, Sri Madhusudan Sai Institute of Medical Sciences and Research, on the 25th of March 2023, and it was inaugurated by the Honourable Prime Minister of India, Shri Narendra Modi. With the vision, in the rural, of the rural and for the rural, the college has commenced with 50 students in September 2023, and it shall mould rural youth into capable and compassionate healthcare professionals to serve rural geographies. The university celebrated its second convocation on the 3rd of July 2023. Srimati Draupadi Murmu, the Honourable President of India, presided over the convocation and gave away gold medals to 17 students and conferred honorary doctorates to 5 eminent individuals. About 50% of these students are first-generation graduates, and about 66% hail from families that are below the poverty line. On the healthcare vertical, over 28,000 pediatric heart surgeries and cath interventions have been done since inception in 2012 through 5 single specialty heart care hospitals in India, the Sri Sathya Sai Sanjeevani Centres for Child Heart Care at Chhattisgarh, Haryana, Maharashtra, Telangana and Karnataka, and 2 such hospitals in Fiji and Sri Lanka. It is the world's largest chain of pediatric cardiac hospitals without billing counters. Conducting research, academic and training programs in pediatric cardiology, nursing and allied healthcare services are other functions of these hospitals. 5 specialized Sri Sathya Sai Sanjeevani Mother and Child Hospitals, Sai Swasthya Primary Care Wellness Centers, Sri Sathya Sai Arogyavahini Mobile Hospital Services for rural India are also serving the sick and needy. The Sri Sathya Sai Sarla Memorial Hospital is a completely free of cost multi-specialty hospital which is also the teaching hospital for India's first free medical college at Karnataka in South India. 12 centers for human development have also been set up across 11 countries for conducting several service and spiritual activities. In the last 11 years, $200 million have been invested globally for these benevolent acts of goodness through which several lives are being illumined every single day. Sri Madhusudan Sai says, "In a society, it is always about the survival of the weakest and not survival of the fittest. We must develop this sensitivity towards the needs of the less privileged and must hold ourselves responsible for each other. Only then can we create an equitable society for the future generation. The onus is on each of us, for the inevitable truth is that every individual's prosperity depends on society's collective prosperity. After all, we are all one connected whole."
This Global Healthcare Conference aims to create a dynamic platform for cross-industry collaboration and fostering dialogue amongst key contributors in the healthcare sector, from pharmaceutical industry leaders, regulators and researchers to hospital administrators and medical professionals, healthcare technology innovators, government officials and policymakers, insurance companies, academicians, and medical students. Over the 2 days, we will listen to talks by prominent individuals. There will be panel discussions on key themes by experts from different sectors, alongside networking opportunities to foster connections and partnerships. We will now have the opening remarks for the conference by Dr. M. Srinivas, who is a director, AIIMS, New Delhi. With an illustrious career of over 3 decades in academics, administration, and research, He has trained thousands of undergrad and postgraduate students. He has been instrumental in establishing more than 10 new medical colleges during his tenure at the ESI Hospital, Hyderabad. Dr. Srinivas, please.
Thank you, Sadguru Pranam. What a great blessings for me. I have Sadguru on the dais and my Guruji, Professor M. Bajpai, who was my teacher, and the teacher is always a teacher. So my teacher, who was also the Dean of Academics at AIIMS New Delhi, he is over there with you. It's a great moment for me, Sadguru and Guruji, Professor Bajpai. And I'm definitely missing Muddenahalli because it's a place of Vishweshwaraya ji, where he believed that the Kayakave Kailasa, work is worship. That's what is the theme which was always resonates from Muddenahalli to the rest of the world. And pranams to our students. There are students from AIIMS New Delhi who have been there, and the students of the Institute of Medical Sciences and Research over there, faculty, administration, staff, policymakers, lawmakers, and all the people who are there, including the medical educationists over there. So pranams to Sadguru, and with Guruji pranams, I just say that it's a great sense of gratitude, in the sense we have been co-hosting this between the SMS, Institute of Medical Sciences and Research, and the AIIMS New Delhi. And this is a great going because, in fact, when the MOU was signed here at AIIMS, Professor Bajpai was with me here on this side, and today he's on the other side. And this is very heartening for us to see him there. And Professor Sadhguruji said that when he visited AIIMS New Delhi, that character and moral values are very important. And this is something which is being taken through the doctors and the medical students in a big way from your mission, Sadhguruji. Now, you are thinking of and convene this conference for the health of the nation, because at the end of the day, we believe that the Rashtra Seva is through the Swasthya Seva, and that's what you have been embarking on this through the organization. And once again, it's a great growing for us, a collaborative research and patient care and activities between the two institutions. And we are co-hosting the Global Conference on Universal Healthcare. And this is a unique example that how a free treatment and education is being given at your institution. This is something which is very important because we know that there were many students who could not afford the education, medical education in this country, and you have opened up the unique institution which gives a free medical education and everything free for the students who join the institute over there at Muddenahalli. And this is I'm very happy that the conference is deliberating on the various initiatives which you have taken, and also with a primary focus on affordable and equitable healthcare. This is something which is very important for us. We at the tertiary centers take care of the super specialties in the tertiary care, but you have been focusing on the primary and secondary care as well also. This is the reason that you have convened this conference, a global conference on universal healthcare, and taking part on the nation's initiative. Today, the Government of India and the Ministry of Health and Family Welfare through the PMJ is focusing on the same thing, how we reach to the masses, how the poor people can also have a universal health coverage. And today the PMJ has shown the results that how the country has gone through the healthcare to the poor patients, poor citizens of this country. And now there is a robust Ayushman Bharat digital mission and the ABHA ID which has been created to make it more accessible and to make it more seamlessly pass on the medical records and the patient health records to wherever they move from within the country. And this definitely, Sadhguruji and my Guruji there, that definitely reduces out-of-pocket expenditure which used to happen to our poor patients in our country. In fact, one of the reasons why our people were becoming poor was the expensive medical care in our country when they go to the various hospitals in our country. Today, the universal health care through the PMJ, a Government of India initiative, for which you are also part of it. Your institution is also offering the PMJ services over there. That has reduced this out-of-pocket expenditure for the poor patients, and thereby you are decreasing the poverty issues of the country as well also. And I hope that this conference, the global conference of various people, the educationists, lawmakers, policy makers, medical educationists, and all the people are sitting there and they are going to deliberate upon how we can strengthen our universal healthcare in our country. I once again thank you and my pranams to the Sadguruji and my Guruji and all the people who have made this conference. And I'm sure that the deliberations of this conference will go a long way in not only giving the policy decisions of this country, but also continuing the services which are happening through your organizations, not only in Karnataka and India, but rest of the world also. Jai Hind. Thank you. Over to you.
Thank you, sir, for your kind words and for continued support. The Honorable Minister for Health and Family Welfare, Government of India, Dr. Mansukh Mandaviya ji, wanted to be here for the conference, but due to his parliamentary obligation, he could not do so. However, he sends his best regards and has graciously sent a letter of appreciation. The letter goes as follows, and I quote, I am extremely happy to know that Sri Madhusudan Sai Institute of Medical Sciences and Research is organizing the Global Health Conference on Capacity Building, Accessibility and Affordability in Healthcare at Sathya Sai Grama, Karnataka. It is a visionary initiative and will go a long way in helping meet the aspirations of a rapidly evolving nation. India is not short of potential, but the need is to harness that towards achieving desired outcomes. Under the Honorable Prime Minister Narendra Modi ji's visionary leadership, we are increasing our capabilities individually, organizationally, and institutionally. It is great to see that your prestigious institution is focusing on creating a holistic ecosystem for ensuring last-mile access to healthcare services. The capacity building plan is a practical plan that will improve the quality of work and services and help all those associated with the medical sector inculcate lifelong learning among them. We are actively working towards modernizing thinking and approach and improving the skill set of our medical workforce. We are making them a true karma yogi. This is in line with our new vision of New India. Initiatives like yours will ensure that competencies are built in our ecosystem for effective healthcare service delivery for India's citizens and will promote role-based learning rather than rule-based and competency-based learning, and also enhance policy making in the field of healthcare and pharmaceuticals. I must appreciate the effort that you all have put in. I am confident that the discussions during the conference will be of high order and will be in line with the vision of creating a developed India by 2047. I am also sure all of us present here will gain immensely from the sessions. I am looking forward to the outcomes of the conference. My best wishes for the success of the conference, unquote. We will now have the keynote address by Dr. Minu Bajpai, Executive Director, National Board of Examinations and former Dean Academics at AIIMS, New Delhi.
Thank you. Thank you. Sadguru Sri Madhusudan Sai Ji, Director Dr. M. Srinivas, of which the Department of Pediatric Surgery at All India Institute of Medical Sciences is very proud of as his lineage. My esteemed colleague and friend, Dr. Hiramat, ace cardiothoracic surgeon, Dr. Suresh Babu, dignitaries on the dais, colleagues, friends, students, and the delegates of this august meeting. Global Healthcare Conference, Augmenting Synergies for Universal Healthcare. We'll all agree that there can't be a better place on earth than this divine institution. I had the honor of meeting Sadhguruji as Dean of All India Institute of Medical Sciences. He was there just a few weeks back, and I can only say that I've been blessed to meet him in a short period of time once again and in his own divine place. Dr. Srinivas, Director, he is a proponent of value-based education for students, And in this institution, students have been asked to keep away from social media so they can focus on the real life situations and learn more. This is a very unique institution. Currently, I represent the National Board of Examination in Medical Sciences. We conduct all the entrance examination for postgraduate medical courses in the country and also the exit examination of broad and super specialties. Our country is short of specialists to the tune of 15 lakh specialists, sir. We only produce 65,000 PGs every year. By this speed, there was no way we could bridge the gap. When our board took over just a few years ago, we realized a gargantuan task which was facing us. Being at the helm of a policy-making institution and an institution which executes postgraduate education, this huge gap was not acceptable. Although we had shown major strides in the last just few years, we doubled up our seats from 4,500 PG seats every year within National Board to 13,000. This was not enough. And therefore, Dr. Paul from Niti Aayog asked us, why can't we increase the number of seats? I'm sharing this with the youngsters in a little more detail because that's how you should think, because the results are there to help you. So we got on the drawing board to realize how we can increase the postgraduate seats in our country, which is so short and there is so much deficit. We realized that any hospital which could be accredited for training in postgraduate medical education has to meet 3 criteria: the case load, the case mix, and the eligibility of teachers. Despite huge number of patients in our hospitals, there is so much of hospital space for training, but they are not participating in postgraduate training. This was because they were falling short of one or the other criteria. So it was amazing to see that the Lok Sabha figures said that there are 70,000 hospitals in our country, looking at small and mid-segment hospital and corporate hospitals. But the National Board only had 1,300 hospitals, and we were able to produce 13,000 PG seats every year through that alone. So we discussed this matter and we realized that the reasons why hospitals do not participate should be addressed. We became flexible, and therefore we launched a policy called joint accreditation, in which 2 hospitals can complement each other's deficit and join forces together to have participation in the postgraduate program. And suddenly we realized that even if we tap 10% of those 70,000 hospitals, we'll have another 7,000 hospitals participating in training. So with 1,300 hospitals, if we can produce 13,000 PGs with another 7,000 hospitals, we can add 75,000 more PG seats. And my colleague said, why go so conservative? At least target 20% hospital, which means we would be able to add 1.5 lakh students, postgraduate, every year to the whole bulk of PGs that we produce. This has been launched by the Honorable Minister, Dr. Mansukh Mandviya ji, in March this year alone. And already hospitals are applying it. We are hand-holding them. And I'd be very happy that I come here frequently as desired by Sadguru ji. He said that, why twice only? You should come here more often. I pledge today that I'll come here as frequently as I can, sir, and help this organization and take help from it so that we can reach out to other hospitals in the region, because this institution already has so much PG programs already. Now, how do we expand the programs? We look at a variety of things. Our population is expanding at both the ends. We have young population which is expanding, and children below 14 years of age constitute 25% of 142 crore of population, which makes them a huge number of people. So we look at that population, and we have about 17 programs in postgraduate courses, including fellowships for pediatric-related specialties. So this was important, because if we don't address their healthcare issues, obviously they are the future adults, and therefore will miss out. Just like the program on nutrition, which Sadhguru ji had started in this place since 2012, which is going on so well. Education and is also as important, and therefore these adults will become our future doctors. On the other end of the spectrum of population, we have the elderly population. The elderly population beyond 65 years is now 7%. It was only 3.3% in 1990. It is now 7% of a 142 crore population. Imagine the number of people who are elderly. It's a sign of very good health. If the elderly age more, it's a sign of good health in the population. But to us as healthcare givers, it brings challenges because many more degenerative diseases start coming up. Therefore, we have started a course on geriatric medicine this year. We have a full 3-year course in DNB in geriatric medicine, and also critical care courses have been started. Even diploma in emergency medicine had been started because our hospitals have to cater to emergencies. And this has been accepted in a very big way by the various organizations. We also look at the disease demography. There was a time in 1990s when communicable diseases were very, very common. They almost included 50% of the cake of diseases of the country. But soon it has been replaced by non-communicable diseases, diabetes, cardiovascular accidents, neurovascular injuries, nephrology cases, metabolic syndromes. This entire cake of 50% of communicable diseases have been largely replaced by non-communicable diseases. So we have now a plethora of courses for DNB and doctorate and national board and fellowship, which can address to this group of diseases. So these are the trends that we see. And therefore we introduce new courses. Number 3 is the sentiments of the government. Post-COVID, the government has just set up. There is also socio-cultural change in the society. People have realized there should be more proactive addressing the treatment. Instead of going for treatment, they want to have preventive aspects to be taken up, the wellness clinics. So you'll be realized that the hospital industry stood 66 billion in 2021 at around the time of COVID. It is going to change now. And therefore, there'll be a concept of multi-specialty hospitals, OPD-based treatment seekers. So therefore, pharma industry accordingly should gear up to address these issues so that patients get treatment. The Ayushman Bharat scheme, which is now also called as PMJ, is definitely addressing issues of people below the poverty line. They easily represent 50 crore of our population. So obviously, this kind of installation and the institution like the Sadguru Institute, we are definitely going to have a big mark in the future as well. So basically, I was going through the campus, this beautiful campus, which was so awe-inspiring. And what I've heard about what Sadhguru ji has done over the last few years alone, although he has dedicated his life right from his childhood, I could see that the future is almost exploding. As I mentioned, that by 2040, the impact of health on global economy is going to be $12 trillion. And it will be through 2 major components of healthcare sector, the hospital space and the devices and the manpower. There's no country in the world which can produce so many specialists than India. This is an open secret, and we can all realize this. The world has realized this. As a result of that, what I mentioned about more postgraduate courses, a year before last, when our health minister, Dr. Mansukh Mandviya ji, had come to our premises at the National Board for its foundation day. At that point of time, I had requested him that the private hospitals, not colleges, private hospital should also be allowed to use the hospital space for MBBS studies, sir. And they are short of pre and paraclinical courses, which we can help them through the medical colleges. A tripartite agreement between National Board, the colleges, and the private hospital can enable MBBS students studying in the hospitals. At that time, we were addressing, in the presence of the Honorable Minister as well as the Health Secretary, CEOs of major hospitals in the country. They were across the table, and they have lapped up the idea. So now preparations are being made so that we can enable more hospital space for UGs, because if you need more PGs, PG is a numerator, the denominator is MBBS seats. Unless we have more MBBS students, we can't go to the next step. In many countries, the ratio of an MBBS to PG is 1:2. There are 100 undergraduate students, there are 200 postgraduate students, because the specialties are now getting organ-based. Knee replacement specialist is different from orthopedic surgeon alone. So in this way, the super specialties are increasing and skill enhancement courses are also increasing. Coming to this institute, because that is my major focus, ever since I have come here yesterday evening, I am seized by the aura and the kind of work which has come to the ground, just not by lip service, but actually by hands-on, a board that I saw in the morning walk. Dr. Sadguru ji had mentioned in one of the narratives in the board I saw that an individual cannot remain happy if his family is unhappy. A family cannot remain happy if the community is unhappy. A community cannot remain happy if the nation is unhappy. And a nation cannot be happy if the whole world is weeping. So therefore, if we go by this ethos, we have to focus on what we can do. The potential of this divine institution is huge. There are many DNB and DRNB courses already running. To get more focus to this institute, I was sharing with Dr. Suresh Babu and Dr. Hiramat, who told me in the morning that he's going to have these meetings. The practical examination of the national board, in South at least, can all be held in this institution. We will talk about this in our upcoming board meeting. Even for the initial few years, if we hold all the national board practical examination here, the number of people that the national board sends from its resources to as assessors, as examiners, are huge in numbers, sir. We have a task force of 4,500 specialists who create questions. There is a team which validates questions. There is a team which checks the copies. There is a team which revalidates the answer sheets again. It's a very tight process, very well orchestrated and structured, and the practical examinations are conducted throughout the country, equitably distributed. Therefore, there are two things which I was take up. I'm going to discuss in my board meeting in the end of this month. One would be, let us take a call, and at least all the specialties which are being done here, all the exams will be done here, so that throughout the south part at least, it's easy to travel. That is why I'm saying the exams can be dealt here. Second is, the National Board of Examination is soon launching the National Center for Skill Development. Sir, skill development is simulation exercises. So a resident who has to do some skill procedure directly on the patient carries a risk. But if he's trained on a simulator, then he breaks the ice, he's more confident. So when he finally does it on the patient, it's much safer. So the National Board of Examination realized that skill development is a very integral part of training of a postgraduate, and therefore we are creating a Center for Skill Development, which is a national center with a 45,000 square foot space, which is the largest in the world, at Kidwai Nagar, just opposite All India Institute of Medical Sciences. Sir, AIIMS being in northern part of India, and that will be the high center, but we realize that the local hospitals and colleges should also have access to centers of this kind. So we have now identified 25 such centers equitably distributed throughout the country, so people can regularly go and then come for final training to the national center. So the second thing which I will propose to the board, sir, this divine institution, your Institute of Medical Sciences should be recognized as one of the centers for skill training. And I'll sit with the faculty and the dean today and bring it to your notice how we can make this center all the infrastructure required for training for skill center. With these words, sir, I'm honored to be here. Pranam to all of you, and to my friend Dr. Hiramat, who actually brought me here. Thank you so much, sir.
Thank you, Dr. Bajpai, for sharing your insightful thoughts and ideas and for very graciously committing your valuable support to our institution. A healthcare hackathon is an event where people from different backgrounds and disciplines collaborate to create innovative solutions for healthcare problems. Usually, a healthcare hackathon lasts for a few days and involves participants such as doctors, nurses, patients, engineers, designers, and entrepreneurs. The participants form teams and work on a specific challenge such as improving patient care, developing new medical devices, or creating health-related apps. May I now call upon Dr. Karthik Ramesh, Organizing Secretary of the Thrive Digital IIIT Healthcare Hackathon. Dr. Karthik Ramesh, please. Dr. Karthik will pray to Sadguru to virtually launch this year's National Healthcare Hackathon. We request Dr. Karthik. Request Dr. Karthik to share a few words, please.
Om Shri Sai Ram. At the outset, I would like to offer my most loving, prayerful salutations and humble pranams to Bhagwan Shri Sathya Sai Baba and Sadguru Shri Madhusudan Sai for blessing us with this wonderful opportunity to be amidst this global healthcare conference and coincide the launch of our National Healthcare Hackathon. Very esteemed guests on the dais, dignitaries of the dais, respected delegates, doctors, medical professionals, students, it is indeed a great honor for me to be here today, not just as the organizing secretary of this National Healthcare Hackathon. I feel very privileged, Swami, to also be an alumnus of Sri Sathya Sai University. And I'm extremely grateful for the wonderful free education which Sadguru Shri Madhusudan Sai continues to offer the entire humanity, and not only about education, but about healthcare. So there cannot be a better homecoming, I should say, for the second edition of this National Healthcare Hackathon. Dr. APJ Abdul Kalam, the late and previous former president of India, famously quoted, and I cite that here, anyone who converts a challenge to an opportunity through innovation creates wealth. We are here to create wealth as organizers of the hackathon, as participants across 25 of the esteemed IITs, 23 IIITs, the Indian Institute of Information Technology, several government-funded institutes, medical universities. We feel that we have come here to earn the wealth of knowledge, the wealth of humility, the wealth of experience which we are going to gain just by seeing the wonderful mission of Sadguru Shri Madhusudan Sai here in person. I'd also like to take an opportunity to welcome several of the delegates who have come to this conference, even from abroad. We have representations from top consulting companies such as Grant Thornton, Oracle, Cerner, which are all into this field of healthcare. I would like to specifically also welcome virtually the organizing partner of this hackathon, healthcare hackathon, Thrive Digital, which is owned by a $30 billion healthcare group in the US called as Highmark Health. There's been a lot of mention regarding government participation and also mention of our Honorable Union Minister for Family Welfare and Health, Dr. Mansukh Mandia. And I recall nostalgically, Swami, that last year we had an opportunity as a group of industry professionals and academic professors to meet him to talk about this grandiose vision. And it is only Swami's will that again today we are standing here for the second edition, and where we saw at the beginning of this event a wonderful appreciation letter. So we are back to completing a full circle. What is this hackathon about? This hackathon is basically to address several of the healthcare issues which the country is facing today. We intend, as participants, as organizers, as mentors, as companies supporting this, to contribute back to the Indian healthcare stack, the Bharat healthcare stack. There are several wonderful initiatives which are going on. Our hope is, with Sadhguru's blessings, over the next 72 hours, various students come together virtually. They hack the problems. They find solutions to technology problems and how technology can be used as an intervention. The pre-launch of this event happened yesterday. The valedictory of this hackathon will happen in IIIT Sri City day after tomorrow. And it's really Swami's blessings that also Sri Sathya Sai University for Human Excellence is going to be a part of this hackathon. We have the postgraduate students participating. Swami, on behalf of the organizers, once again, we sincerely thank you. And I would like to now request for a very important video to be played by His Grace Gauranga Das Prabhu, who visited Muddenahalli a few months back, had an in-person experience of the wonderful healthcare, nutrition, and education initiatives which are going on. Being an alumnus of IIT Mumbai himself, when he heard that this conference is happening and we are coinciding the launch through Sadhguru here, he has sent a very personalized message acknowledging and thanking Sadhguru and the organizers of the Healthcare Hackathon. May I request the video to be played of His Grace Gauranga Prabhu, who is the director of ISKCON's Govardhan Eco Village.
Hare Krishna, I'm delighted to be part of this video message to congratulate Thrive Digital, IIIT Sri City and Planotech Group for organizing the National Healthcare Hackathon 2023. This hackathon is a wonderful initiative to bring together the best minds in the field of healthcare technology, science and business to create innovative solutions that can transform the lives of millions of people in India and beyond. Healthcare is one of the most important and challenging sectors in our country. It requires constant innovation, collaboration and compassion to address the diverse and complex needs of our population. I am especially happy to congratulate Shri Madhusudan Sai, a global social and spiritual leader, for inaugurating the event at Muddenahalli, the birthplace of one of India's most accomplished engineers, Shri M. Vishweshwaraya. Shri Madhusudan Sai has been serving the most needy in the areas of nutrition, education and healthcare across 33 countries globally through his institutions of excellence that offer all services absolutely free of cost to all without any discrimination. It is heartening to see this hackathon happen at Shri Madhusudan Sai Institute of Medical Sciences and Research, India's first totally free medical college that aims to produce doctors with a heart of gold and the hands of steel. I am sure that this hackathon will provide a great opportunity for the participants to learn from the experts, mentors and peers, and to showcase their talent and creativity in solving some of the pressing problems in the healthcare sector. I am also confident that this hackathon will foster a spirit of collaboration and synergy amongst the industry, academia and social impact non-profit organizations and create a platform for future partnerships and projects. I wish all the participants, organizers and supporters of this hackathon all the very best, and I pray that may you all be successful. Thank you and Hare Krishna.
Our gratitude to His Grace Gauranga Das, and now we will have a short 1-minute video played by the CEO and President of Thrive Digital, the organizing partner, who could not make it here, as I was telling Swami, because of the cyclone aftermath in Chennai. Can we have the video of Mr. Balasubramaniam Shankar Narayanan, CEO, President, Thrive Digital?
Hello all. I'm delighted to be part of this video message to congratulate IIIT Sri City, Planotech Group, and Sri Madhusudan Sai Institute of Medical Sciences and Research, and of course my own organization Thrive Digital for organizing the National Healthcare Hackathon 2023. It's indeed very fitting that the event is being launched at Sri Madhusudan Sai Institute for Medical Sciences and Research. Very grateful for Sri Madhusudan Sai, a global leader in the spiritual area, and of course known for his philanthropy, especially in the field of healthcare and education. Thrive Digital Health is part of a global healthcare enterprise and a health tech leader that has been managing the care and health journeys of millions of people each year. Our parent enterprise has a deep and rich history and legacy in healthcare excellence. And we as a healthcare product and platform company are deeply committed to truly transforming healthcare as we know it and take it into the future. At Thrive, we believe that the foundational pillars that help us accomplish this kind of massive transformation are innovate, collaborate, empower, and do so with empathy. And that is where such hackathons come into the picture. They're a brilliant way of bringing together the young minds in the field of healthcare, technology, business, empowering them to innovate freely, all the way providing them the opportunity to collaborate with other young minds as well as with mentors and experts. The result of this hopefully will be innovations that transform the lives of millions of people globally. This event, I think, will provide that right environment for participants to learn from experts, to flex their innovation muscles, and to help inculcate the spirit of collaboration across all of the different players and drive future partnerships that will help us increase this social impact to our own communities. I wish all of the participants, the organizers and supporters of this hackathon all the very best. On a personal note, I wish I could have been there with you in person today. Many of us in Chennai have had to deal with Mother Nature's fury a few days ago, and we're still in the process of recovering from the same. While I may be a refugee today, I do have an increased gratitude quotient towards the higher power for the many things that I do have, the things that we all take for granted each day. So on behalf of the 4,000 Thrivians, I thank the dignitaries who have graced this occasion. I thank all of the participants who are looking to change the future of health, and I thank the higher power for allowing us the opportunity to collaborate and drive such events. Thank you, and all the very best.
Thank you. At the end, I would just like to conclude by saying that this hackathon has a prize money of 6 lakhs, which will be given to the winning teams. We are also lucky to be partnering with the International Innovators Association, which is headquartered in Geneva. And they have promised, Swami, that they will help incubate some of these ideas for the larger benefit of humanity by creating social impact in healthcare. I would now request, with Swami's permission, the dignitaries of the hackathon who are present here, the various leaders, Mr. Ram Ananta Subramani, Mr. Giridhar L.S. from Grant Thornton, Professor Bhushan, who is from an institute of eminence, Mr. Darshan, the chairman of Planotech, and Mr. Rahul, senior data scientist from Oracle, Dubai. Please join us on the stage with Swami's permission. Swami, we would like to just offer you a token of gratitude, because today morning I remember that in the institute prayer which I attended, the students gave me a beautiful lesson. They said the word of the day is to prevail. And Swami, together, collectively, I request the dignitaries to please come on stage for a group photo and to dedicate to Swami that, Swami, we will prevail. As Henry Ford famously said, and I quote and conclude, coming together is a beginning, staying together is progress, working together is ultimate success. Swami, today, these organizations commit to participating in your revolutionary movement and service to mankind, especially contributing to the healthcare movement. We would like to now offer a small token of our gratitude and love to Sadguru Sri Madhusudan Sai.
We now invite Shri B.N. Narsimha, Chancellor, Sri Sathya Sai University for Human Excellence, to address all of us.
I offer my loving pranams at the lotus feet of Sadguru Sri Madhusudan Sai, who is today recognized as a global champion of two great legacies left behind by Bhagavan Sri Sathya Sai Baba, imparting education with wisdom and providing healthcare with compassion. Dr. Minu Bajpai ji, the keynote speaker of the morning, Shri Ramesh Babu Garu, Shri Dharmadatta Garu, leaders, stakeholders, representatives from various fields, aspects of healthcare sphere, students of AIIMS, faculty from AIIMS, students of our medical university, faculty of our medical university, and very dear brothers and sisters. Thank you, Dr. Bajpai ji, for that very powerful, thought-provoking, and enlightening keynote address. I would like to acknowledge that you are one of the most powerful speakers from the medical fraternity. Rarely we find medical professionals who are good speakers, but the kind of sincerity that all of us could feel in your very, very thought-provoking initiatives was very, very uplifting for every one of us, especially for our students and faculty, I would say. And I would like to thank you for the appreciation that you have heaped upon this center of learning, culture, selfless service. In fact, when Sri Narendra Modi from the same platform, when he inaugurated our medical college, the first free of cost medical college in our country, the first sentence he spoke was this, that Sathya Sai Grama, under the leadership of Sadguru Sri Madhusudan Sai, has set a very great ideal of selfless service. And you have gone around the campus, as you said yourself, and that's a good encouragement for all of us and a real tribute to Sadguru Sri Madhusudan Sai, I would say. And coming to the very flexible ideas that you expressed on behalf of the government of India. So that's very important, very, very important. One of the problems in our country that has become a hurdle in providing healthcare to the needy, to serve the unserved, is the lack of flexibility in sometimes we see in the government policies. But your forthcoming flexibility definitely would help us, help the many stakeholders in the sphere of healthcare to move forward with greater enthusiasm and inspiration. One very important point, which was an eye-opener for me, for most of us, among 70,000 hospitals in India, only 1,300 hospitals are teaching hospitals. And your vision to at least pull in another 7,000 hospitals for training postgraduates in medicine and surgery is a very wonderful idea. And talking of flexibility, the problem that we faced in Sri Madhusudan Sai Institute of Medical Sciences and Research, we proclaimed ourselves as an institution of the rural, for the rural, by the rural. And we wanted to admit into our medical college with a concession from the government, needy children from rural areas. But we could not do because of the lack of flexibility in the very tight criterion of need ranking. See, I am not saying that you should admit needy students from rural areas if they are not qualified in need. Yes, that is a must. We accept. But going by the top ranking for admission was a real hurdle. The needy students from rural areas don't have the kind of facilities. They don't have the kind of encouragement or even coaching for NEET as the urban students and city students. So therefore, it happened that we could not fulfill our aspiration of admitting the rural needy children into our medical college. I request you whether anything could be done in this regard. And also, I very much appreciate Dr. M. Srinivas, who acknowledged you as Guruji. Now I understand why he acknowledged you as Guruji. We had heard about your name, but today, he has so much reverence for you because you have inspired him. And Dr. M. Srinivas is today known as one of the inspired medical professionals who is bringing about great changes, keeping in his mind the Gandhiji's talisman, so-called Gandhiji's talisman. Now, this particular conference, wherein we want to promote perfect synergy among various stakeholders, will be successful if every one of us, every one of the stakeholders can take this talisman known as the Gandhiji's talisman. He said, definitely this advice was more for leaders and enlightened and educated people. Whenever you are in doubt about your idea, you think of the face of the poorest person that you have seen in your life and ask yourself the question whether this is going to help him in any way, whether this is going to liberate him from the throes of the sufferings of poverty. Go for it. Otherwise, drop it. This is their talisman. If each and every one of us can think, keeping aside the motivation for making money, because in a world, especially the healthcare world, which is pervaded by rank commerce today, the courage to take money out of the equation of healthcare and medical education is taken by Sadguru Sri Madhusudan Sai. That is the legacy of Bhagavan Sri Sat Sai Baba. When he founded one of the first of his kind super specialty hospitals at Puttaparthi, dedicated to serving the unserved, dedicated to serving the needy. He took the first step, and Sadguru is following in his footsteps. And just to make a point, how it can help to serve the unserved. The Sri Sathya Sai Sanjeevani Pediatric Cardiac Hospital, established under the leadership of Sadguru Sri Madhusudan Sai, is a case in point. 18 island Pacific nations around Fiji did not have a single cardiac surgeon till Sadguru thought of it and established this hospital. Imagine any children born with congenital heart diseases, if the parents are rich, they go to New Zealand or Australia. Otherwise, they had to simply die in front of their parents. No government took any initiative. No, even the World Health Organization did not take this initiative. He thought of the poor children. And he took the initiative, galvanized support, mobilized funds, and with government support. The government came forth very, very forthrightly. They granted us 6 acres of land almost adjacent to the parliament in the city of Suva, the capital of Fiji. And philanthropists from all over the world who are devotees of Sadguru pooled in their funds very selflessly. And this hospital was inaugurated 2 years ago. And it is the one and the only ray of hope for children born with congenital heart diseases in all the 18 island Pacific nations. And last year, April, when we visited Fiji, we saw the parents with their children being given life certificates on the stage by the Prime Minister of Fiji. And looking at their faces, the children and the grateful parents, I tell you, is the greatest fulfillment. And I would also like to congratulate our student, Dr. Karthik Ramesh, for initiating this National Healthcare Hackathon here. And he is one of the very brilliant alumnus of our universities, the Sathya Institute for Higher Learning. And finally, it is my request, if you go through the brochure of this healthcare conference, in the introduction, one point is stated. Point is, we have to walk the talk. See, many conferences happen and many meetings happen, but have we reached the last person in the queue is the question. Whether it is nutrition, whether it is education, whether it is healthcare, see, that is a question we have to ask ourselves. This can happen when everyone who thinks of alleviating the suffering of the poor people especially, because the sustainable development goals declared by the UN, see, they have given great importance to good health. But rich people everywhere definitely have access to healthcare in every country, even in poorest of the countries. We have visited a country like Nigeria. There also there are good hospitals, only for the rich people. Where do the poor people go? Therefore, the passion that pervades, the passion that inspires Sadguru Sri Madhusudan Sai to go all out very sincerely to tackle this problem of providing good education, complete education, and good health care to the poorest of the poor should pervade the minds of everyone participating in the conference. Then definitely something very substantial would come out of it. Once again, I thank Dr. Bajpai ji for your very, very enlightening talk. And we look forward to working with you for augmenting the kind of synergy which we are thinking of in this conference, and also rushing to the help of the poorest of the poor, especially the children, the poor children who die. See, hardly you find very small percentage. Of course, you pointed out that the number of senior citizens has grown in the recent years, but at the same time, percentage of infant mortality is also quite high in India. Not only in India, all over the world, especially in the backward or the developing countries, there is a problem. Therefore, praying to the Almighty that under the leadership of Sadguru Sri Madhusudan Sai, we conduct the meetings of this conference in a very meaningful way and come out with very fruitful suggestions. I conclude my talk and pray to Sadguru Sri Madhusudan Sai for his benedictory blessings in the form of his message. Thank you very much.
Our children from the university chanted a Shanti mantra from the Upanishads. ओम सहनावतु सहनौ भुनक्तु सह वीर्यं करवावहै तेजस्विनामधीतमस्तु मा विद्विषावहै. Om Shantihi, Shantihi, Shantihi. In this, the teacher and the student together pray. When they come together to learn and teach, they pray, Om Sahana Avatu. Let us be protected together. In old times, Pathshalas, Gurukulams used to be in the forest. And you do not know what kind of issues you can face, from wild animals to natural catastrophes to maybe even a COVID virus. So they prayed that when we have started on this journey of learning and teaching, let us be protected. May God protect us. Sahanau Bhunaktu. Let us enjoy whatever we are going to teach and learn together. It's not enough if teacher enjoys and the students suffer, or student enjoys and the teacher does not. So let us enjoy this process of learning together. Sahaviryam Karvavahai. Let us work hard. Let us strive together. It's not enough if student works hard and teachers don't. Both have to work hard to learn and teach. Tejas Vinamadhitamastu. Whatever the effulgence of knowledge happens through this interaction between the teacher and the learner, may that brighten our minds and may that knowledge stay with us. Let us not forget tomorrow what we have learned today. Ma vidvishavahi, very important. Let us not be the cause of hostility or sorrow to each other. Let us be kind to each other while we learn and teach. And let peace prevail in the body, in the mind, and the spirit. So any conference also should start on the same note. Let us be protected throughout the conference. Let us enjoy the proceedings of this conference. Let us work hard, strive to come up with solutions, the outcomes that the conference is intended to generate. Let us be mindful and let us be reminded of our duty after the conference too, and not forget it as a nice intellectual gathering. And finally, let us be kind to each other through the conference and thereafter, so that we make partnerships, we make networks, we work together in collaboration and cooperation even after that, and bring happiness and prosperity to the people. And that is how peace will follow. So taking that idea and the idea of Indian scriptures which said, Sarve Santu Niramaya, may everybody have good health. May nobody be unhealthy. And even if they are unhealthy, they should have access to health care so that they can become healthy. This idea of universal health care, which is in recent times is only a couple of decades old, was the ancient way of life in India, where everybody thought that everybody should be healthy. Why? Because in everybody's health only our health is also ensured. People around us are sick, we cannot be healthy. Dr. Bajpai was quoting one of the, I think, sayings, and if I can modify a bit, there cannot be a happy or there cannot be a healthy individual in an unhealthy family. There cannot be a healthy family in an unhealthy community. There cannot be a healthy community in an unhealthy nation. There cannot be a healthy nation in an unhealthy world. So that is the paradigm that we must face. COVID has taught us nobody can remain healthy individually. If somebody falls sick, everybody falls sick. That is collectivity of the society. As society, we are interdependent. We all are tied to each other. So what if the whole is at the other end of the boat? We are all going to sink. We can't take solace in the fact that we are on the opposite end of the boat. Boat shall sink someday or the other, and we all shall sink with it. Therefore, mending these holes in the boat of healthcare system is the need of the hour. How do we ensure that this healthcare is accessible, affordable, equitable to all citizens of the world? And that is the idea. Survey is not just survey Bharatiya Santu Niramaya, survey Santu Niramaya. Let the whole world be healthy. And that is possible in this age and time only if the health care is made more accessible through affordability and through equitability. And this is the idea of this conference. When this conference idea was mooted by our very enthusiastic devotees and volunteers, and many great dignitaries were invited to be a part of it. The idea was to ensure how can we work as different units of the society, as governments, policymakers, which Dr. Bajpai is representing, as industry, Dr. Ramesh and many, many more of you are representing that, So also Dharmadata Garu, who was earlier in policy and governance, and as private institutions. That is we, the charitable institutions, NGOs, social service organizations, civic body organizations can come together to ensure Sarve Santu Niramaya happens, not in some distant future, but in our lifetime. And this is the idea of this conference, and I'm sure with so many of you together and many, many of us who are joining us live and who could not make it here, I'm sure this conference will lead to very practical solutions, implementable solutions to this idea of universalization of healthcare, at least in India to begin with all of us together. We have very eminent people from the pharmaceutical industry, healthcare industry, and also healthcare technology industry. Now the borders have all merged and there is no working in silos. Everybody has to work together to deliver the healthcare. And as Hackathon was being mentioned by Dr. Karthik, and I mentioned it to Dr. Minu that this is what we are talking about, and he said there is going to be another course in DMB about AI in healthcare, use of artificial intelligence, predictive medicines. Now the tech talk is totally different. Simulation is still there, but we are further going and talking about predictive algorithms and treatment protocols which are predictive through AI. All this is necessary for delivering healthcare. It's no more about just doctor-patient relationship. It's so much more that comes together to deliver or universalize the healthcare coverage. I'm very glad that our country, led by our Honorable Prime Minister and the Health Minister, Mandaviyaji, in the healthcare spectrum, have taken very great and bold steps, which has never happened in 7 decades. But they have taken very bold steps, and PMJ Ayushman Bharat Yojana is one of the very bold steps. The largest universal healthcare coverage program of the government in the world. Covers over 50 to 60 crore people in the country through central and state schemes. And we are also an empaneled hospital through the Ayushman Bharat scheme. However, we found some gaps, and we did mention it to the Honorable Minister as well as the PMJ program team, and somebody will be representing them today. They got delayed last night, so they couldn't make it in the morning, but maybe in the evening, discussing how to make it happen. While the intentions are good, where are the gaps in the delivery? Why the last person is still not able to utilize it completely, despite so many hospitals being a part of PMJ? How can industry, pharmaceutical industry, device manufacturers, hospitals, whether physical or digital, with their infrastructure, can make healthcare more accessible and affordable is the discussion that we must have. And we all have to come together. PMJ rate cards are there, and there is a lot of debate on the amount and things like that. But with our experience in our hospitals, which are run very efficiently, at very low cost model, no frills model, just do what needs to be done model, we are able to manage within the card rates. And I don't see a reason why somebody should complain about it, unless there is some extreme case of an emergency or extended hospital stays because of some unavoidable circumstances. So I think it's a very well thought of scheme, and that is one part of delivering the healthcare and universalizing it. But also I am worried about a big middle class. The missing middle is what is called. A 2021 report of NITI Aayog, which was presided over by Dr. Vinod Paul, he mentions that almost 40 crore Indians fall into this category who are not covered under, who are not so poor to be covered under Ayushman Bharat and not so rich to pay for the private insurance, similar to the situation of Medicaid and Medicare in the US. And they are the missing middle. They also need health care. Yes, they can pay to some extent, but not all of it. And they also can get into bankruptcy. I'm told every year 7 crore Indians are pushed into or pushed further into extreme poverty because of healthcare costs. Much of 60% of this cost is out-of-pocket expenses. So hospitals like us provide complete care. There is no out-of-pocket expense for the patient at all. The attendants are also given accommodation, food, till there is a patient admitted in the hospital and being treated. After that, medicines are also provided. Jan Aushadhi is another great scheme. Through generics, pharmaceutical industry people understand that better. But making generics available to the people, high quality, that is something again we are trying to utilize. And we are very happy that device manufacturers, equipment manufacturers and pharmaceutical industry people are supporting us in whatever way they can to reduce the costs further, and so that we are able to achieve the Ayushman Bharat rate card costs or maybe even lower, and make it very efficient models of healthcare delivery. I'm sure you're aware of our hospital is become a business now. Healthcare has become a very large business because people can wait for anything, but they cannot wait to treat themselves. If they have a health emergency, they will have to stake everything they have to save themselves or their loved ones. So they know healthcare is a very emotional thing, not just a physical necessity, but an emotional burden. And everybody goes all out of their way to save their loved ones. So it has become, unfortunately, a business. So-called for-profit hospitals, don't want to talk about it, but even for non-profit, my question is that though they are not for profit, but what is the cost of healthcare over there? Let us check that. Why are they not able to implement government schemes like PMJ? Though they call themselves as not for profit, because the costs of healthcare are still high. Too many frills, too many other things which cannot be covered under that scheme. So I think hospitals like us, which are very efficient, low cost, and economies of scale, that brings down the per patient cost in these hospitals, which can be further brought down if we have good support from all sectors, from the policymakers, from the industry, like all of you, and of course from many other charitable organizations who are part of it. Corporate social responsibility is another path-breaking program, does not exist in any other country. I must tell you, when I was sitting in the US in a room full of entrepreneurs who had made it big in the Silicon Valley, and I mentioned to them that in India, 2% of net profits is to be given for charity. That's mandated. In US, there is nothing like this, but at least you people should get together and offer 1% of your net profits in charity. There was pin drop silence in the room. Nobody wanted to commit to it. So I again want to appreciate the policymakers for making CSR mandatory in India. Sometimes charity has to be mandatory, otherwise we are generally not very charitable as human beings. So there is always a reason why we invest this rupee to make another rupee on it. But sometimes we have to think of the less privileged ones. And by making it compulsory, again, policymakers, the government has taken up as a path-breaking step, which needs to be appreciated. Ayushman Arogya Mandira, as it is called now, what you call as wellness centers, 1 lakh of them are mushrooming in the country everywhere. Again, that's a great initiative to reach access of healthcare to the rural populations. The question again remains about the quality and efficiency of those systems, which again goes back to the manpower, capacity building. And I'm very glad that Dr. Bajpai mentioned such innovative programs in super specialty care building in the country, the capacity building in specialty spaces. General physicians is one thing, but in rural areas, specialists are not there. And that's where the demand is. And they're taking such great measures. Again, it's very heartening as an institute. I think we are more than committed to ensure that these visions of the government are completely manifested and are implemented in the rural areas. And I'm very glad, whether it's the simulation center that you're talking about, skill development center you're talking about, or tomorrow even artificial intelligence-based healthcare center with so many technology partners, we as an institute are more than committed to offer whatever we can to work together as partners, as collaborators in delivering the healthcare to the last person. So we are very appreciative of your commitment and vision to include many more private agencies, hospitals, and other stakeholders in this program, and making it a very stakeholder collaboration-based effort. And that is the idea of the conference. It's a convention, is coming together, Sahana Bhavatu, let us come together, work together, enjoy this knowledge together, implement these ideas together, and maybe we be of help to each other. Today's reason for this convention, and a very young institute like this could not have been possible without the collaboration with All India Institute of Medical Sciences, which is pioneer in universal healthcare delivery. For decades they have been working, and I know most of our country depends on the AIIMS, especially AIIMS New Delhi, for super specialty care at a very low cost, almost no cost. This is again something which is very heartening to know, and we are very appreciative of the partnership with All India Institute of Medical Sciences. And while on the capacity building, Dr. Srinivas was mentioning that we need to definitely produce doctors, nurses, paramedics for a country which is growing by the day. But more importantly, culture building is also very important. And one reason why he wanted to collaborate with our medical college was that we could teach culture and character to the upcoming doctors, paramedics, nurses. And what does culture mean? So to me, culture simply means concern for the other human being. If you are concerned and sensitive to other person, you are a cultured person. Otherwise, however rich or wealthy you might be, however educated and literate you might be, if you have no humanness in you, no concern for others, you are not a cultured person. So our definition of civilization and culture is when we look after each other. And that is the culture building that we want to do by creating sensitive doctors to the need of others. Medicine is not a profession. Medicine is service. Healthcare is a service. It's not a profession. Yes, when you do service, some returns will come to you by virtue of whatever offerings you have made. Like when we go to a temple, we offer a coconut, at least we are hopeful we'll get back half of it. Today's temple is not sure. But when you do offer service, healthcare as a service to the patient, something will come back to you. Your welfare will be looked after. That was the ancient Indian model, where Vaidyas never charged anybody. They were all affiliated to a temple or some institution like this, public service institution, in that village or in that community. And their welfare was looked after by the community in general, by the kings or the rich people. They patronized the temples and they patronized healthcare services through which Vaidyas, midwives, they could deliver services at no cost. It was very equitable, it was universal, no discrimination whatsoever, socio-economic. And that is the model we want to bring back into India, because that is how India was the Sone ki Chidiya. The moment we brought in all other models of sustainable economics, we ended up in the place that we are in today, absolutely inequitable, absolutely divided and divisive society. It wasn't the case earlier. Education was free, healthcare was free. All this was patronized by and supported by the society at large, by the kings, by the wealthier people, by the donations to the temples. They are the ones who ran these institutions, not the kings. Temples ran these institutions. And because they were selfless, therefore the quality of delivery was the highest, because there was no ulterior motive or agenda behind delivering education, healthcare to people. So our institution is a humble effort in that direction, to revive that ancient Indian culture and create a new model, sustainable development goals. Till now, we have not achieved that. We keep it's a moving target. From 2015 becomes 2030, and next, I don't know where it's going to go. But very first four sustainable goals talk about no poverty, zero hunger, talks about education and health and well-being. I'm not saying we should achieve it on one fine day or a date on the calendar. It should be sustainably achieved. There should not be people who are hungry ever. There should not be anybody who is uneducated ever, unhealthy ever, or poor ever. And even if somebody is falling into that bracket, there should be a social protection mechanisms to pull them out and put them back to where they belong. And that is the new normal, that is the new world we want to create. And India's opportunity is now. 25 years of rigorous work can make us the developed country, where this dream of Sarve Bhavantu Sukhinaha, Sarve Santu Niramaya, Sarve Bhadrani Pashyantu, Mahakashchit Dukkham Apnuyat can be achieved. And to me, that is a developed nation that we must create. And the most foundational stone on which this developed nation can stand is good health care. If people are not healthy, they cannot get educated. They cannot work and pull their families out of poverty. They cannot contribute to the country. They'll become burden on the society. And everybody will suffer because of those few who are unhealthy. So to make people healthy and keep the nation healthy is a collective responsibility. So industry should do its part, making medicine more affordable, available, cutting the costs of supply chain, and delivery systems can help us reduce the cost of manufacturing and distribution. And that can help institutions like us to reduce the cost of healthcare even to much lower. That will help us to deliver that same healthcare to so many more people in the same budget. So I am looking forward to much more partnership, capacity building on one side, specialty capacity building through DNB programs and similar programs as I was talking about, through exchange, student and faculty exchange, so that we can share the knowledge that we have. We all don't have to invent the wheel again and again. What AIIMS knows, this institute can learn. What this institute knows, AIIMS can learn. So collaborative research programs, problem solving, and faculty and student exchange programs is the way to share our collective wisdom. Hackathon involving the IT industry into the healthcare domain and helping solve problems of the future, which is possible to deliver only through technology. There is no other way. Whether it's called telemedicine, where you call it predictive, all kinds of things that are coming up. I've been traveling around the world learning from many healthcare systems. And I've seen how US is pioneering, championing technology in healthcare. They are the forerunners. They're always 20 years ahead of the rest of the world. And today I see how they're implementing technology in healthcare and making it far more accessible. Point of care devices, home care, especially what you mentioned, geriatric care is becoming a big issue in developed nations like US, Japan, Australia, Europe. And there are no professionals, human beings available. So only machines are doing all the job, monitoring, alerting, even advising. So much of technology has permeated that a doctor without understanding of technology cannot be a doctor in the future. They have to join hands. He has to be a part engineer and part doctor, a hybrid, I think. That is the model of healthcare we need. And for a country of size of ours, technology is the only way to deliver healthcare to the rural doorsteps. So I do not know what else we can think of during this conference, but we definitely must think of complementing each other and supplementing each other with whatever we have, so that a new model of healthcare India can give to the world, which is truly universal, not just in paper. And this is the ancient Indian way of healthcare delivery, where nobody was denied healthcare for want of money or access or any other reason. It was given to whoever deserved it. And that is the model we are creating. Our humble effort to make healthcare education free is also a contribution towards this idea, so that these children who do not pay for education do not have to worry about recovering the costs of their education or even making money out of it. That is one way of making sure that these children will become doctors of the future, nurses and paramedics. They'll be willing to serve in rural areas even at a lower compensation or lesser compensation than what you can get in a corporate hospital. And I'm very, very afraid of the future scenario. I was in the US and they were talking about medical tourism. And they were saying, if you bring the, आप तो हार्ट वाले हो, आपको पता है, यहाँ पर जो $10,000 में काम हो सकता है, US में आपको $100,000 देना पड़ेगा. तो वो लोग क्या कर रहे हैं? They want to bring patients to India and get them treated, because the travel and the cost of medical care and returning back is far lesser than the actual cost of just the hospital fee of doing a heart surgery in the US. My worry is that that will put additional strain on our existing healthcare system, because now we'll be catering to the global patient crowd. And our poor people will be further pushed behind because they cannot afford. So before such a day comes, capacity building is important, culture building is important, and more important is character building. Malpractice insurance in the US is a big cost of healthcare. I hope such a day doesn't come to India where we spend 20-30% of resources in covering ourselves for malpractices. Our children should never practice malpractice. They should be ethical doctors, character-based doctors who do the right thing for the patient, not right thing for the profit-making ventures of called hospitals, not right thing for the lobbying industry, not right thing for the greedy, ulterior motive-based leaders. They should do right thing for the patient. That will again bring down the cost of healthcare and make it available to all. So concluding this, thanks to Dr. Srinivas, Dr. Bajpai from All India Institute of Medical Sciences and DNB program who have come here. And I have one more request, Dr. Bajpai, that we want to bring integrated courses in healthcare so that the time for training into specialty care can be reduced. I've seen this, Stanford has it. I've seen it, many other, even PG courses, some of them have it. And NIMHANS has it in one of the courses. But I've seen even cardiovascular diseases related, Stanford University has a course. It is 6 + 1 years, which compresses the total, whatever the training period, to lesser time. Otherwise, it will take 10 to 15 years. You do a general surgery, CTVS, then you do a pediatric or whatever. It takes a long, long time. Again, that's not the way to do capacity building. I'm not saying we should cut corners and do poor training, but the kind of hospitals we have, the caseload, the case mix, and the training facilities available to train people into pediatric cardiac care, definitely nowhere in the world we will find. So using these opportunities, if we can kind of compress the training programs, I think our students will be very happy, because they can become surgeons faster, and good surgeons, not just as any surgeons, because the kind of load they see here and the mix, that definitely will make them better trained doctors. So that is another request I have. I'm sure it will also be discussed in your board meeting in the month end. And I look forward to you be coming more often and guiding this institution. We are very happy to set up a center for skill development, simulation, artificial intelligence, whatever, make it a center for excellence, and in which we need the support of everybody. And I'm very grateful that you, despite the cyclone and all other issues, so many of you have come to this ashram. It's not the elite address in Bangalore city or some metro. It is almost like nameless place except for Vishweshwaraya. Nobody knows why that this place exists. But I have seen the son of the soil like Vishweshwaraya went all the way to become a Bharat Ratna. And the rural child has that potential. This is what I want to tell. Muddenahalli has proven it. And so rural children should be promoted, should be given the opportunity. That is the capacity building for the rural, by the rural, of the rural is that. Take children from rural India, give them the capacity building programs, training, and put them back into the rural India, because they are the best who can serve the rural India. So I really look forward to much more out of this conference and many more in the future. And I hope I have thanked everybody who's been a part of this, Dharmadata Garu, to great initiative to invite a lot of pharmaceutical companies. Ramesh Babu Garu I met him in Hyderabad. He showed a lot of enthusiasm about the model that we are talking about. Again, they're pioneers in their own fields. So they all have to come together. Rigveda says, Ano Bhadra Kritvo Yantu Vishwataha. Let noble thoughts come to us from all directions. I think I need to take a cough syrup. I do not know from whom. Some of these companies cough syrup. My throat has been a little under the weather. But I didn't want to miss the opportunity of transmitting my ideas and thoughts to all of you when so many of you have gathered. And I'm sure at some point in time we can create that India that our ancients always dreamt of. Sarve Sant Niramaya India. That would be the greatest contribution we can make in our lifetimes. Wishing and blessing everyone complete success in this venture, I conclude.
Once again, offering our collective gratitude to Sadguru, we conclude the inaugural session. We will have a short break for 10 minutes and will reconvene at 11:30 for the first technical session for this morning. Thank you.